Thanks, Karen. I'm Dr. Jay Luspater. I'm a member of the board of the Prevention of Blindness Society and also the chair of the Department of Ophthalmology at Georgetown University. And it's great to welcome everyone here with us today. Age-related macular degeneration is obviously a very important topic to discuss. It's the leading cause of blindness in the United States among people 65 and over. And February is actually Macular Degeneration Awareness Month, so this is the perfect time for us to be hosting this presentation. And it's a real pleasure for me to introduce today's speaker, Dr. Mariam Mathai. And Dr. Mathai did her ophthalmology residency in our department at MedStar Georgetown University Hospital, MedStar Washington Hospital Center, and then did a vitreoretinal surgery fellowship with the Retina Group of Washington and Washington Hospital Center. She's now in practice with the Retina Group of Washington and continues to be very involved in the teaching of our students and residents. So Mariam, welcome, and the floor is yours.
Awesome. Thank you so much, Dr. Luspater. Let me just share my screen here with my presentation. Okay. So as Dr. Luspater already mentioned, we are talking about age-related macular degeneration today. And my name is Mariam Mathai. I am one of the associate physicians at the Retina Group of Washington. So just a little bit of background. This is a photo of the back of your eye, the center of the vision of the back of your eye. There's the optic nerve, which is the nerve that connects your eye to your brain and sends a signal from your retina, which are the nerves on the back of the eye, to your brain. The center of the vision, where your fine vision is from, is called the macula, and that is in this area here. So as Dr. Luspater alluded to already once, age-related macular degeneration is actually the #1 cause of blindness in the United States for patients over 60 years old. Other causes of blindness in the US include glaucoma and diabetic retinopathy. So macular degeneration in particular causes loss of your central vision. It's often a bilateral disease, but can be asymmetric, with disease being worse in one eye versus the other. It's also slowly progressive in most patients to where they're asymptomatic until something rapidly worsens. Unfortunately, it's painless, so we're not cued into these changes, and it has a heavily genetic relation and is associated with smokers. So macular degeneration affects the central vision to where you start seeing distortion early on, where images in the center of your vision start looking a little bit abnormal. As the macular degeneration progresses and is not treated, it can cause significant blurring and then eventually lead to full blackout spots of vision. There are two types of macular degeneration. The first type is dry age-related macular degeneration, and the second is a wet form, and we're going to talk about those both today. The way we diagnose macular degeneration is with routine eye exams, specifically dilated eye exams. The American Academy of Ophthalmology recommends that everyone over the age of 40 gets screened with a dilated eye exam every 2 years. And if you're over the age of 65, that should be around every 1 year, more for patients with pre-existing retina problems or diabetes. One way we help find macular degeneration in addition to the dilated eye exam is with additional photography, including something called optical coherence tomography, which we'll show you some photos of that in a minute. So as a reminder, on the right, this is a normal eye. It looks very healthy. On the left, there's a photo of a patient with dry age-related macular degeneration. You can notice in that center part of the picture, there are all these yellow fine deposits throughout the retina, and these are called drusen. The drusen are characteristic of dry age-related macular degeneration and are essentially buildups and deposits of metabolites that your body could not get rid of as you age. This is a photo of the OCT image that we were discussing. It's a high resolution scan of the very center of the vision called the macula. Normal has a nice U-shaped dip at the center of the vision, and you can make out all the layers of the retina within the photo, almost like a layered cake. And if you follow these layers across, they make pretty much a straight line. That is normal. Patients with macular degeneration, particularly dry macular degeneration, you will see drusen, or those deposits, distorting the outer retina, causing it to be wavy, like you see here. Patients with dry macular degeneration can have a huge range of symptoms, and often can be asymptomatic even when our photos look quite dramatic. Right? Typical symptoms include distortion, as we were discussing, and blurred vision. Patients with a certain subset of dry macular degeneration called geographic atrophy can unfortunately go blind. All right, this type of dry macular degeneration is very advanced, and at this point in time is untreatable. So this is a point of macular degeneration that we would like to avoid. There are some ways we can reduce the risk of progression of your macular degeneration. Number one is smoking cessation. Smokers have a 3 times increased risk of developing advanced forms of macular degeneration. So just a simple lifestyle change can significantly reduce your risk. And if you already do have macular degeneration, will reduce the risk of worsening disease. Healthy diets are important, particularly eating leafy green vegetables that are high in folate and B12 can help reduce the progression of macular degeneration. Controlling your blood pressure and your cholesterol, and of course, routine screening, particularly if you have a family history. We, as ophthalmologists, like to monitor patients with dry age-related macular degeneration every 6 to 12 months, depending on the extent of the drusen or deposits that you have in the back of the eye. At home, you as a patient play an important role in identifying any changes to your macular degeneration. Patients with dry macular degeneration will often see no distortion. And one way we monitor this is by using a chart called an Amsler grid. The Amsler grid is depicted here on the left. It's essentially a box of checkered straight lines. The way you use this chart is you check your vision with one eye at a time. So you cover up your one eye, and looking at the center dot in the picture, and look and make sure all of these lines in your vision are looking straight, like a straight checkerboard. Okay. Patients with macular degeneration, particularly wet macular degeneration, will notice when they do this, they see areas of distortion and waviness and maybe even blurring. That is abnormal and a reason for you to see your eye doctor immediately. Unfortunately, there's no effective treatment to reverse vision changes when you have dry macular degeneration. But one thing that can help progression to needing treatment is something called AREDS2 vitamins. They're multivitamins that reduce the risk of progression of your macular degeneration by about 25% over a 5-year period, and it's a multivitamin. This multivitamin has an AREDS2 formula in it, and it's just a mixture of vitamins and minerals that the National Eye Institute of the NIH found reduced and helped decrease the progression of age-related macular degeneration. We as eye doctors often get asked about any supplements that can be helpful to protect vision as you age. And there unfortunately aren't many. There are no pills or treatments that prevent cataracts or diabetes. There are no drops that prevent those. But the one thing we do have are these multivitamins for macular degeneration. It's a very simple and easy thing to take that you take twice a day, one multivitamin twice a day that specifically is formulated in this pattern. All the bottles should say AREDS2 specifically, and that reduces the risk of progression of your macular degeneration. Now, everyone shouldn't go out and buy these vitamins. It's only for patients who already have some level of macular degeneration. If you don't have any regular macular degeneration, just doing the things that we discussed before, like eating healthy leafy green vegetables and not smoking, should be protective enough. So if you already have macular degeneration, the biggest thing I want you to know is make sure your bottle says specifically the AREDS 2 formula. While other formulas may work, this is the one that was proven in multiple studies over millions of patients to be helpful. So look for that label on the bottle. Some of the common names that we see that we know have the reliable formula are PreserVision, Ocuvite, Focus, MacuHealth, and MacuGuard. But there are other brands that make similar vitamins, and as long as they use the AREDS 2 formula, it should be safe. And if you have any questions, you can always bring it in with you. For patients who have low vision issues, you should also ask your primary ophthalmologist about referral to a low vision specialist to help see if there's anything that can assist in your visual needs, particularly those patients with advanced dry macular degeneration with geographic atrophy. Now, we've kind of harped on only dry macular degeneration up to this point, but what many of you have probably heard of via friends or family members is wet macular degeneration. Wet macular degeneration is considered the most advanced form of macular degeneration. It's when bad blood vessels grow from the outer walls of the eye where the blood supply of the eye is and grow through the retina like weeds coming through the retina. This unfortunately can cause a lot of issues in the back of the eye. Only about 10 to 15% of patients who have dry macular degeneration progress to this wet type of disease, but this wet type of disease is potentially blinding without treatment. The vision loss occurs because of those bad weed-like blood vessels coming through the retina and bleeding, causing problems similar to this. Now, this is a big bleed right in the center of your vision, which can really take out the vision quickly and can occur in the matter of a few days. When something like this happens, it's considered an urgent issue that you need to see a retina specialist for to start treatment. This is another scan of that OCT image, just showing how there's this black space that wasn't there before underneath the retina is actually blood from the wet macular degeneration. When you go see your retina doctor, they may also do some other images that help highlight those bad blood vessels underneath your retina, including a dye test called a fluorescein angiogram, where we circulate an orange organic dye through your veins and then take photos of the back of the eye to see where those blood vessels are and show and highlight those areas of issues. And we can monitor this to see your response to treatment. Now, treatment of macular degeneration is something that many of you have likely heard about. It's injections of medicines into the eye. These medicines target those bad blood vessels that grow like bleeds, and they target a specific molecule in the eye called vascular endothelial growth factor. These medicines were discovered on accident because they are actually used as treatments for colon cancer. And what we found that patients that were getting treated for colon cancer had improvement in their problems with macular degeneration and diabetes. And that's how it was realized that this was a helpful treatment. 10 to 15 years ago, these treatments didn't exist. And unfortunately, wet macular degeneration had no good therapies and these patients were going blind. But now with these injections, we can typically preserve your vision. There are multiple different types of these injections, multiple different names. The one that's most commonly used is Avastin. It was the one that was originally discovered. But then there are some newer medicines called Lucentis, Eylea, and Vabysmo. The way I tell my patients is most eyes respond to all of these medicines, meaning that more than 90% of patients respond and have improvement in their macular degeneration to all of these medicines. But everybody's eye is different. So your doctor may want you to try one drug before the other. And these medicines can always be interchangeable based off of your response to the treatment. Now, getting injections in the eye is quite scary for people, but it is something that we as retina specialists do all day long because we treat patients with this with strokes, diabetes, and macular degeneration. It is an in-office procedure, and you go home the same day. You don't need to cover up your eye or anything afterwards. The process of the injection is we numb the eye with lots of numbing medicine. We then put a spring between your eyelids to keep your eyelids open for us, very similar to how we're seeing in this picture. We use a solution called betadine that prevents infection over the surface of the eye, and then do the injection. The injection itself, as scary as it sounds, is not painful because we have numbed the eye. The most irritating part is actually that cleaning solution. It's almost like a soap that prevents infection. So some people, especially patients who have pre-existing dry eye disease, have some burning and irritation for an hour or two after the injection, which improves with the use of artificial tears. The injection itself lasts less than 1 second. And most of my patients, it has become routine. Patients who receive these injections can have significant improvement. If you see here, this patient presented with a little bit of bleeding. The picture's not all that clear, but there's a little bit of blood from wet macular degeneration, and that's this lime green area here on the scan. They did one injection, and all of that blood went away. Now, that's not how everybody's eye responds. Some people need multiple injections to improve, and some people may need multiple injections for the rest of their lives to improve. The biggest thing that we stress is that these injections, unfortunately, are not a cure. There is no cure for wet age-related macular degeneration. We can only treat the problem. Treatments are usually given monthly. Those injections are usually given on a month-to-month basis for at least a period of 3 to 6 months when you first come in to see us. And then long-term, we try and decrease the amount of injections you need. But it's important for us to treat you very aggressively early on to protect your sight. Our goal is to maintain the vision that you have when you come in for treatment, and if possible, improve it. But sometimes if this isn't caught early, it may cause permanent scarring, and the injections can only do so much. So it is very important that if you notice any changes in your vision, you come to see us quickly. What's amazing though is, as I said before, these medicines didn't exist 15, 20 years ago. And that meant everyone who had this type of macular degeneration went blind. But thankfully now I have many patients who have been able to maintain driving vision even 10 plus years after getting these treatments. So there are some future treatments mostly aimed at decreasing the amount of injections you need long-term. And it's just new drugs that are in the pipeline. Most of them are longer acting, or possibly the extended release implants that can be placed in your eye, and even in the future, possible genetic therapies, as we discussed, as this is heavily genetic. Now, that was all I had for our talk, but if anyone has any questions, please, you can put it in the chat, or I think Sean can help us moderate.
Absolutely. Yeah. Thank you so much, Dr. Mathai. This was really, really great. I know I always learn so much whenever I hear about these different eye conditions and diseases. So everyone who is on the line right now, if you have questions, there's the Q&A box that you can put your question in. Additionally, if you can't figure that out, if you raise your hand, I can give you permission to talk to do that. While we're waiting for that, so one question that we commonly get is, you talked about how it can go from dry to wet. Is it possible to go from wet to dry macular degeneration?
Once you have wet macular degeneration, unfortunately, you will always have wet macular degeneration. As I said just a little bit ago, unfortunately, we don't have a cure for this. We just have treatments to decrease it. Now, some of our wet macular degeneration patients may have pictures that look like they're dry because they're undergoing active treatment, but unfortunately, you cannot go to dry. Now, over time, after many treatments, you may need less and less injections and be less dependent on it, but unfortunately, never completely switches back.
All right, folks, please feel free to put your questions in the question box. I know there's going to be a couple folks who have some questions. Then while we're waiting for that, Dr. Mathai, what are you most excited about with where research is at right now in treatment of AMD?
Sure. So some new medicines that are about to be approved by the FDA are for the dry type of macular degeneration, which previously we didn't have treatments for, particularly the patients with very advanced dry macular degeneration with scarring in their center of the vision with the geographic atrophy. Previously, there was nothing we could do for that. And even right now, there's nothing we can do when that happens, when it gets that advanced. But there are new medicines that are being shown to stop that progress. And that could now save vision similar to the way our wet macular degeneration treatments are saving vision. So that's very exciting.
Okay. And then we had another question, somebody who has diabetes and they have diabetic retinopathy. Is it possible to have both diabetic retinopathy and AMD? And if so, how do you tell the difference?
It is possible to have diabetes in the back of the eye as well as macular degeneration. The two are not exclusive. Macular degeneration is more often genetically associated, but diabetes is, of course, related to your blood sugar control. Some ways we can tell the difference is by the exam and the pictures. If there is there are certain types of bleeding that are very characteristic of diabetes versus macular degeneration. And that dye test also helps. The fluorescein angiogram, it highlights the bad blood vessels. In diabetes, you would have blood vessels throughout your retina, whereas in macular degeneration, you would only have blood vessels in the center of your vision. Thankfully, treatment for both is actually with the same type of medicines, the anti-VEGF medicines that we talked about before. But it is, and there are ways that we can distinguish between the two.
Great. Thank you so much. So here's a question we got in the chat box, or in the question and answer. Why is there no cure for macular degeneration?
So the retina, this is a very complicated question and very frustrating for us because we all wish that there was a cure. But the retina is nerve tissue and it's basically part of your brain. And science just hasn't gotten there yet to where we can cure it. We are only to the point where we can kind of halt its progression and decrease its effect, but we just have not been able to cure it. They're working on it, but who knows if that'll ever happen.
Great, thank you. All right, next question is, could you say a little more about the implants and how they work and for how long?
Sure. So there is a few implants that are coming in trials. So there is nothing on the market right now that you go into the surgery, you do an operating room surgery and place an implant into the eye. Then that implant acts like a reservoir for a lot of that same anti-VEGF medicine. It sits in there and slowly releases into the eye. You then have to get it refilled every few months with new medicine, but it decreases the number of treatments you need and number of visits you need. But unfortunately, there was one on the market a few months ago, but it was pulled because they were noticing some side effects. So once again, we're still in the process of trying to get there.
All right, thank you. Is there a certain demographic that's more prone to getting macular degeneration?
That's an excellent question. And yes, there is. Caucasians tend to have the higher risk of macular degeneration, but nothing is 100%. I treat many patients of African-American descent and Hispanic and Latino descent as well with macular degeneration. So all patients can get it, but it tends to be most common in Caucasians.
Great. And then a follow-up question for that is, AMD is age-related macular degeneration. Are there other forms of macular degeneration that people should be aware of?
There are other forms of macular degeneration, but most of those are diagnosed when you're much younger, as they are passed down when you're a child or to your early 20s or 30s. But the most common type of macular degeneration is age-related macular degeneration.
Great, thank you.
Mhm.
All right, this next question, you mentioned early detection of wet AMD is important, but is there anything else that can help other than an Amsler grid? Is there anything else that they can notice, I guess is the question.
Sure, that's a great question. So there are a few devices that your doctor can prescribe to you. It's called the 4C home device that helps it monitor a different way of doing that Amsler grid, and it reports back to their monitoring system. And if they notice any differences in the way you're recognizing some patterns that they show you, that can alert the doctors to seeing this. Soon to be approved and in the process, just with advancing technology, is at-home OCT imaging, meaning those pictures that I showed you, that they're starting to have them become available publicly, so that you could keep those at home and take photos. And those photos would report any distortion or change back to your doctor and bring it in sooner. So that's in the future coming up. But the main thing right now is taking those vitamins, the AREDS vitamins, and using your Amsler grid.
Thank you, thank you. This is another question about people who are more at risk, and this is asking, why are women more likely to get AMD than men?
So historically, the thought was that women actually lived longer and had a higher. In general, women tend to live longer, and that was likely why there was more women than men who had macular degeneration. But now it's pretty thought to be equal, and it's more the genetics that is associated with it, and smoking.
Great. And then the next question about, well, one is how fast can I lose my vision with AMD? But then also is a follow-up with, if you switch suddenly to wet from dry, what do you do if you can't easily get to your doctor?
Sure. So, how quickly can you repeat the first question, Sean? I'm sorry.
Sure, yeah, absolutely. So how fast can I lose my vision with AMD?
So everybody's eyes are different. The vast majority of people with macular degeneration will have a very slowly progressive disease that never takes away their vision. And we're very lucky for that. But there's a small subset of patients who will have sudden big bleeding that could happen in the matter of days. And that's the thing that we always worry for, with a big bleed in the back of the eye that could take away your vision quickly. So there's a whole spectrum of patients who may have macular degeneration that's mild, that never really bothers their vision and never causes them issues. And then there's a whole, on the other side of the spectrum, patients who have no problems and then 2 days later have significant vision decrease from a new bleed. So unfortunately, everybody's eyes are different for that answer. And what do you do if you can't get into your doctor? In general, most of our ophthalmologists across the board have somebody, at least a front desk staff, that you can talk to and explain your problems and issues to. And if you're ever having an issue getting in with your primary ophthalmologist, the Retina Group of Washington also has a triage center for that as well, particularly for macular degeneration. And if they feel that you need to be seen, we can usually get you in within a couple of days at our practice. And sometimes even the same day for emergencies.
That's really good to know. And just so people know, just for a reminder, what's the name of your practice?
So my practice is called the Retina Group of Washington. I'm going to re-share this screen here. I see patients in Rockville and Silver Spring, and 1 day a week in our Capitol Hill office in DC. But my partners also see patients all over. We have 17 locations throughout the DMV that can be seen. But there are many, many primary ophthalmologist and optometrist who can also get you in to be seen and screened. And if they feel that you have a retina issue or a new macular degeneration, they'll send you over to us.
Wonderful. Thank you. All right. And this question you may not be able to answer fully, but I think you might be able to give a little bit of insight. Would you recommend injections for a 90-year-old female that was recently diagnosed with wet AMD?
So again, this is a little bit of a nuanced question.
Yeah.
If somebody came to me and said, I have a patient with wet macular degeneration, what would I do? My blanket answer would say, yes, start treatment. Okay. But everybody is in a different life situation. I have patients over 100 years old who are doing everything that they need, everything on their own. They're very independent. And those patients, if they were to lose their vision from wet macular degeneration, would have a huge difference in their quality of life. And those are the patients. So there are certain people that I would say 100% treat. Now, there's some patients where it may be a little bit more tenuous. However, in general, vision is important for mental health and independence for everyone, regardless of your health status, regardless of your age. So I always would encourage people to get treatment. Treatment is tough though when you're 90 years old, especially if we're needing monthly injections, and that's not lost on us as retina specialists. So what we typically try and do is decrease the number of injections you need over time as best as we can while preserving your sight. But yes, I would recommend treatment regardless of age.
Yeah, I was a little afraid it might have been a little nuanced there, but
yeah, it's definitely a little bit nuanced, but I think the best answer for me to give is yes, I would recommend treatment, because no matter what, even if you yourself or your parent, even if they're 90, 95 years old, vision is a huge part of your quality of life. You can't watch TV, you can't communicate, you can't see your loved ones. So it is very important. And I think is worth treating regardless of age.
Great. Thank you so much. All right. Now we've really started to open up the questions, Dr. Mathai.
Okay.
Start, but now, yeah, we have quite a few now. So first thing, talking about AREDS vitamins. Are there side effects that are common with these vitamins?
The most common side effect is actually an upset stomach, and that happens with most medicines. The easiest way to alleviate that is taking it with food. But that's the most common side effect I hear from my patients. Thankfully, most of the ingredients are vitamins, so they're not particularly harmful or abnormal to your body. Most patients are already taking similar supplements in just a regular multivitamin, just not at the same doses.
Perfect. And let's see, thinking about research now, stem cell research, is this still a possibility that's on the forefront with AMD, especially for wet AMD, or has it kind of taken a back seat?
It's definitely not taken a back seat. It's out definitely currently in clinical trials. The main issue with stem cell research is that there are a lot of things that put you at risk for macular degeneration. It's not just one gene, it's a whole group of genes. So it's a little bit hard just where science is to target one problem, but they're working on it. They are definitely working on it. Not me in particular. I do not do that type of research, but it is in the process. Stem cells are being studied for everything and a lot of things in the eye, because we're able to do things very localized. So probably will be one of the first places it'll be implemented.
Thank you. And just thinking about the research side of things, we always have a couple people that are interested in learning more. Where would you direct people who want to find, what's actually being researched, and where's some safe websites to look for really accurate stuff?
Sure. Always one of the best resources for patients for eyes across the board, whether it's macular degeneration or anything else, is our American Academy of Ophthalmology website. There is a whole section dedicated to patient care and can be helpful in patient education. So you can look up whatever your doctor said that you have, and there will be a lot of information sources for you to read through. For macular degeneration in particular, we also have an American Academy of Retina Specialists that has similar patient information. And if you're ever confused or want a good resource, you can ask your general ophthalmologist or your eye doctor, and most of us can point you into what are good resources. While everybody always cautions against Googling things, I think the internet is actually very helpful as long as you're reading trusted and approved resources. So we can always offer you those, give you those names.
And Mariam, if I can interrupt for just 1 second, in terms specifically of research, the National Eye Institute also has a great resource of all the various clinical trials that are going on all topics in ophthalmology, including macular degeneration.
Perfect. Thank you so much for chiming in there. Yeah, both of those are really great resources. I know myself, I've learned quite a bit on those websites, and they're easy to understand for sure. All right. So people who have glaucoma or other eye conditions, are they at a higher risk to get macular degeneration, or are they mutually exclusive?
They are mutually exclusive. So sometimes patients may have glaucoma, they may have diabetes, and they may have macular degeneration. They're all mutually exclusive and don't increase the risk one way or the other.
Okay. And I have to think that has to be a fun case for you all when you have somebody that has multiple things. What typically do you do whenever you have a patient like that?
So although it's such a small part of the body, the eye is very, very complex. And we have specialists for every little part of the eye. So what we do as retina specialists is we treat the macular degeneration, and we rely on our ophthalmologist colleagues to treat the glaucoma and the cataracts and the other issues in the eye. Retina specialists specifically, we treat diabetes in the back of the eye and strokes and macular degeneration and any issues going on with the retina. And then our colleagues help us out with the glaucomas. So it would mean a little bit more treatment and a lot more eye exams, but hopefully not too many of our patients are in that situation.
Great. Yes, hopefully.
And we all work together, so we share our information, vision and eye pressure. And if you come to see me, you'll probably, if you lingered around a few minutes afterwards, you'll notice I send a letter to all of our doctors, just so they have it on file that you saw us and how your exam looked that day, so they have a comparison.
Great. Thank you. All right. Our next question. Once you're getting shots for the wet version of macular degeneration, can dry macular degeneration still cause damage?
Yes. Dry macular degeneration, even with the treatment with the injections, can progress to that form that we were discussing called geographic atrophy. But the best way to limit that is still taking those multivitamins and possibly new medicines that are coming out over the next year or two. But that is exceedingly rare, I will say, but it does happen. From somebody who sees these patients all day long, we do have a few patients, but it's not common.
Wonderful. Thank you. And we did have somebody ask about repeating the resources. Folks, I'm just going to put that in the chat box for you all to see. It was the American Academy of Ophthalmology and the National Eye Institute. All right. Next question. Here's an interesting one. So thinking about the world of insurance, are these macular degeneration exams covered? And then also, what about the shots and the treatments that you all get?
That's a great question. And healthcare is a huge stress and a burden to everyone, and especially healthcare costs. So yes, screening, annual exams for normal eyes is included in your health plan, and screening for macular degeneration, whether it's dry, needing more than 2-3 times a year, or more, like even up to a monthly basis, if you have wet macular degeneration, is covered. Treatment for injections is also covered by your insurance. And we work with those drug companies to make sure that you are approved for the medicines, and a lot of these medicines have copay assistance programs as well that we can sign you up for if your insurance has a large copay with each visit.
Great. Thank you. Yes, that's definitely a question we get frequently, is the insurance piece. So I'm sure you all do as well.
But the insurances, they definitely do cover. Sometimes our administration needs to fight with them a little bit, but we are used to handling that. And the insurance companies know that this is a vision saving treatment. So they do approve it. I've never had an issue where a patient couldn't receive a medicine.
Wonderful. Thank you. All right. So our question here, and I'm going to rephrase this a little bit. Thinking about, a retina doctor, you have to see so many patients a day, which means you don't get to spend a bunch of time always with the patient. So when somebody's preparing for an exam, what would you recommend they have ready to go, or how can they prepare themselves so they get the most out of that eye appointment with you?
Sure. I think everyone, whenever they see their doctor, it's such a flurry and there's so many other things going on. You're meeting technicians, screeners, front desk staff, that in the moment you forget what you planned on going in to ask them. So I always stress my patients, write down things that are coming up over the times between our visits, have a journal or something for your own health, and that you can bring in so we can make sure we answer and adequately address all of your concerns so that you don't leave and remember something a few hours later that you wanted to discuss. I think that's the easiest and best way. And then we can know that it's almost like giving us a checklist that we can go through to make it together to make sure you've reviewed everything that you had questions about.
All right. Thank you so much, Dr. Mathai. And just so everyone knows, in the chat box, I did put a guide that we also have prepared from Prevention of Blindness about preparing, and it does include things like creating a checklist, just like you had mentioned, and some of the other pieces. All right. So we do still have time for another couple questions if anyone has any more. In the meantime, while we're waiting, Dr. Mathai, if there's like two things that you wanted people to take away when it comes to macular degeneration and what they need to know, what would you tell them?
I think the number one thing with macular degeneration would be screening is imperative. So even if your vision seems fine, there may be small changes that are occurring in the back of your eye that you wouldn't know, whether it be from macular degeneration to diabetes to cataracts or glaucoma. A lot of these diseases of the eye don't show up and aren't symptomatic until it's too far along. So seeing getting a routine eye exam is extremely important. And then once you do develop macular degeneration, those vitamins really do help. I think a lot of times we read about variable effects of multivitamins, whether or not they're useful, whether or not they are getting absorbed. But the studies have shown that these multivitamins for macular degeneration do help. And it's an easy solution for you to kind of improve the chance. And I guess, can I add a third? No smoking. Smoking is definitely not only for the eyes, but smoking in the eyes in particular can increase your cataracts rate, can worsen your diabetes in the eye, and can also worsen your macular degeneration. So smoking can have a huge effect. So definitely controlling that as much as possible.
And does that include vaping?
It does. Anything with nicotine is included in that.
All right. Thank you so much, Dr. Mathai. That's great. We did have another question here. Thinking about the injections, can that cause scarred tissue over time on the eye?
Unlikely. The injections themselves usually prevent that scar tissue from forming. Some people may get some bruises that are temporary on the white part of the eye where the injection goes through, and it's like a red spot that goes away, but nothing permanent.
All right.
The needles we use are very, very small, much smaller than the needles that you use to, say, get a vaccine shot or get your blood drawn. So they're very, very small.
All right. Well, I don't see any more questions in the chat box right now. Dr. Mathai, thank you so much for joining us today. I know I learned a lot, and I can tell everyone learned a lot because they were asking so many great questions. So we appreciate you taking the time today to educate us and to share.
Yeah, definitely. This was great. Happy to come back whenever.